13 years ago, I started my PhD out of frustration. There was so little evidence to help children and young people with dystonia and movement disorders that I set off into clinical academia, not fully knowing how steep the learning curve will be, and it has felt very steep at times. Clinical academia is hard for everybody. For medics, the pathway is difficult enough, but for us in nursing, midwives, and AHPs, it can feel monumentally bigger, with a higher wall and with the structural barriers that are still very real. I personally have been extremely privileged. Many people have supported me, including and particularly medics who saw something in me before I saw it myself. They believed that the questions I was asking mattered. And back then I wasn't thinking about answering them with research. I was thinking as a clinician. And this is something that actually came up in my NIHR doctoral fellowship. But the people who have shaped my career the most has been the children, young people and families that I've worked with. They have given me many of the questions that I've gone on to champion. They helped me co-create research that isn't possible or fashionable or fundable, but actually necessary. And I've been told more than once that nobody will fund research on dystonia. And then here I am with an incredible NIHR Advanced Fellowship behind me. Perhaps they saw what I did see, which is research that is clinically relevant and that matters in real life and that can improve care. I also hold what it feels like a flying pink unicorn post that is jointly funded with a joint contract, with aligned to the Follett principles. It is rare, and I won't pretend otherwise, and yet so many clinicians will make that jump but still face the barriers I saw 13 years ago. And these barriers persist with no enough accountability from host organizations. I am an NHS patient, my family are NHS users. I want the best care from the whole clinical workforce, not just medics. And clinical academia shouldn't be the privilege of a few, but a pathway for all clinicians and practitioners asking the questions patients, families and services need answering.